Dr. Henry, you said a couple of minutes ago not to make Super Bowl plans. Does that mean that restaurants can continue to operate as they do now, or are some type of restrictions coming?
Yeah, so those are discussions that we're having again with the industry. If the restrictions are followed the way that we have them, we know that those environments can be safe. So it is both sides here. If we know, my message to people who are running bars and pubs and restaurants, you have to make sure that you have the important safety provisions in place. And WorkSafe BC and our environmental health inspectors will be stepping up their monitoring and enforcement of that. But it's on us as well. We should not be going with a different group every night to a restaurant. We should not be breaking those rules that puts staff and restaurant businesses at risk. So if we want to be able to safely have these moments to enjoy, then we need to do them differently this year, and we all have to take responsibility. We're the only province right now where we have been able to keep these businesses open, but it's because we have these safety plans in place. And when we start to flaunt those, that's when we're seeing transmission happen, both to staff and between people in those environments. So we've seen some of the enforcement that happened this weekend in Whistler. So yes, it's safe to watch the Super Bowl, but do it with your household. Do it in a way that doesn't increase the risk to everybody.
And just to be clear, many people have Super Bowl or Grey Cup parties in their homes, and that is not on this year. This is the year to watch it with people living in your household, to watch the Super Bowl game with people living in your household, and only those people. Those environments are the wrong environments right now. Occasionally in the past I've attended Super Bowl parties, Grey Cup parties, and they're events that are almost designed for the spread of COVID-19 and the various things that occurred at them. In your home this year, it's only people in your household. So I understand your question was about restaurants, but in your home, no Super Bowl parties.
Bender, do you have a follow-up? Oh, sorry.
The Stanley Cup Finals, which are going to be in July, we'll be in a different place in July. I hope.
Bender?
Well, I'm an NFL fan, so Dr. Henry, I also wanted to ask you, I mean, you're kind of hinting at where we're headed with these restrictions. And, I don't expect you to tell me today, what the decision will be Friday. But how much of a concern is it for you that people say, look at this dude's having this party in his penthouse, allegedly. All I want to do is gather with one friend in my backyard, 6 feet away for 20 minutes. How worried are you if these restrictions continue too long that people will not listen?
Yeah, it is a terribly challenging time, and people are listening, and most people are doing the right thing. Sure, sit outside with a friend for a few minutes, go for a walk. Those are not risky activities in the grand scheme of things. It's the indoor parties with different groups of people every night, and we know that's happening. Where we're seeing transmission in many of the communities is in young people, and we know that is linked to small social events that people are having. So it's not okay to have my one or two friends that I have dinner with tonight, or my one or two friends that I go out with today, and then a different group tomorrow. And that's our nature, unfortunately, when we're young, and that's what we want to do. We're at that period of time where we want to go out and make connections with people. We have to have some self-restraint right now. We will be able to do that again. But right now we're seeing that that's how this virus is getting transmitted, and we don't yet have enough people protected that we aren't going to get spillover into people who are going to end up in hospital and people who are going to, unfortunately, have serious illness from COVID. So we have to be able to keep to our small group, find ways of connecting with each other and supporting each other to do this right now. To get us to the period where we have enough vaccine that we can protect enough people. And it's not people maybe I'll just leave it at that. I understand how hard it is, particularly for young people at this point in time, but we also know that young people care about their communities and they care about their families and they care about doing their piece. So I know that when we say this, people know what to do now. And yes, it is challenging. We have this concerning variant that is causing havoc in other countries, and we don't want that to happen here.